So the eye is one area where imaging is very, very advanced, thankfully. And so today we have diagnostic techniques that, for example, does something that is similar to a CT scan of the brain. It's called an optical coherence tomography or an OCT. The OCT literally is able to tell us details of all the 10 layers of the retina. So there are 10 layers in the retina. The most important are two layers. One of them is called the photoreceptors or the rods and cones. And the rods and cones are like the building blocks that sit on a foundation called the retinal pigment epithelial cells. So they sit one on, one above the other. The rods and cones, below which is the retinal pigment epithelium. Now, so today we can do OCT in the outpatient. It's a very quick scan that's done. Takes less than 5 minutes, and that tells us the details of these layers at the central part of the retina, at the macula. So because of that, diagnosis is far more easier today. And then you have other diagnostic modalities. Of course, one, we do the photography of the eye itself, and then we examine the visual fields. There are objective ways of assessing the visual fields. It's called perimetry. Again, these are very easily available. And then the OCT, and a couple of others like fundus autofluorescence and so on. So these are mostly available in almost all ophthalmic setups. So because of that, it is not very difficult, at least, to understand there's something that's not okay in the eye. The difficulty is in LCA, where the eye examination itself could be normal. And so in most children with LCA, we do a testing called an electroretinogram. So when we talk about the fundus photo and the OCT and so on, we are looking at the structure of the retina. So to assess the function of the retina, there's a test called the electroretinogram. And in fact, it's done in almost anyone who presents with these genetic diseases. So an ERG helps in being able to tell us what the functioning of the retina is. So, for example, in a child with, let's say, retinitis pigmentosa, because here is a disease that affects the rods first more than the cones. So some parts of the ERG get affected. In an LCA, for example, both the rods and cones get affected. So in a nutshell, it's not very difficult to make a diagnosis. The trouble is only with LCA, where sometimes we have to do an ERG under anesthesia. Because in an adult, an ERG is done as an outpatient setting, whereas in a child, we may need to do an ERG under put the child, give the child general anesthesia, and then do the ERG. So that's a little bit challenging. So those are the ways that we really diagnose what is happening clinically. This is now called the phenotype. So whatever is the clinical information, we call it the phenotype, in a given person.